morning. My name is Dr. Chen. I'm a geriatric psychiatrist here at UCLA. And the topic I'm going to present today is on vascular dementia. So for those of you who may have participated in our webinars before and to those who are joining us new, you can post questions, you can ask questions using Twitter or commenting on Facebook using the hashtag UCLAMDChat if you're on Twitter. Okay, so what is vascular dementia? I sort of designed this talk for family, for caregivers, for people who work at facilities who might care for some of these patients. So what is vascular dementia? I'll start first by talking about what vascular dementia is not. It's unlike Alzheimer's disease, unlike frontotemporal dementia or Lewy body dementia. The problem with vascular dementia is not in the brain. It's not with those other types of dementias. The problem is within the brain cells or between the brain cells. With vascular dementia, the problem actually starts with the blood vessels that supply the brain with blood and oxygen. So usually there's the types of vascular problems or blood supply problems in vascular dementia are what we call ischemia or inadequate blood due to narrowing of the arteries, or sometimes there can be a bleed that causes disruption of blood supply to the oxygen. And that leads to death or injury of brain cells, causing dysfunction of that particular part of the brain. So you can have either large single strokes that can affect brain function. You can also have what we call microvascular injuries or disease, where small vessels are involved and small parts of the brain are damaged over a longer period of time. And they may not be noticeable. They may not manifest as what you might expect from a stroke. It may be a very, very subtle or what we call subclinical type of injury. They don't really have any clinical symptoms associated with it until they accumulate gradually over time. So this problem with the vascular or blood supply to the brain can sometimes lead to dementia, and that's where we have cases of vascular dementia. And what is dementia? Some of you who may have participated in some of our other webinars in this series know that the dementia is defined as an impairment in memory or other cognitive functions, as well as impairment in one's functioning. So not only do they have memory impairment or problems with word finding or maybe finding their way around or disorientation, but also with problems with daily activities. So problems with, say, managing finances or driving or running errands. That's what we mean by functional impairment. What are some of the common clinical features of vascular dementia? Usually there's some abrupt onset in symptoms. So there's, the patient is doing fine, they seem normal, and then there's an abrupt change in their ability to remember or ability to think. And then over time, there can be a stepwise decline as the patient experiences either small or large vascular events or even strokes. And this commonly can affect one's gait or ability to walk. It can affect other motor abilities, such as fine motor, motor coordination. It can also affect one's ability to control bladder or bowel, so that can lead to incontinence. And then it can also affect one's mood. The patient might seem a little bit more, have a little bit more trouble controlling their mood or their affect. So they might actually laugh or cry inappropriately or for no apparent reason. How common is vascular dementia? Well, in the United States, vascular dementia represents the second most common type of dementia. Alzheimer's disease is by far the most common type of dementia, comprising of roughly 2/3 of cases, but vascular dementia comes second, representing somewhere between 10 and 20% of all cases of dementia. And amongst the elderly, 70-plus year-old people, about 4.2% have vascular dementia. Vascular dementia is more common in men than in women. It's also more common in African Americans as well as Asians, suggesting there may be some genetic component to the risk. But there may also be some associated lifestyle factors as well. We know that, so in Japan, vascular dementia is actually the most common type of dementia. And we think that maybe diet is an important factor. Interestingly, Hawaiians who are of Japanese descent, so they share some of the genes with their Japanese relatives, but they also have a different diet and a different lifestyle. Their risk for vascular dementia is actually somewhere in between people who are Japanese living in Japan and people who are not Japanese living in the US. So I'd like to compare vascular dementia to Alzheimer's disease to sort of give a sense as to how these two are different. So with vascular dementias, as I said in the first slide, are caused by strokes, both large and small, that lead to damage or dysfunction of parts of the brain. And whereas in Alzheimer's disease, it's related to problems with the brain cells and also the actual brain tissue, parts of the brain that lie between cells. The onset of vascular dementia is usually abrupt, whereas with Alzheimer's it's more insidious and maybe it just kind of creeps up on you. And then over time, with vascular dementia, you might see a stepwise decline, as opposed to Alzheimer's disease. It is more of a gradual, progressive course. Both vascular dementia and Alzheimer's patients will experience memory loss. However, they may be, at the earlier stages, there may be some distinction in the type of memory loss. In Alzheimer's, patients tend to be more amnestic, so they'll have trouble remembering words or remembering events, even if you give them clues or hints. In vascular dementia, they are able to store the memory or encode the memory. They just have difficulty recalling the memory or retrieving the memory. So if you, in a typical test in the office, we might give them 3 words to remember. And the people with vascular dementia will have difficulty remembering the words, but if you give them clues, they will often be able to then retrieve those words. Both types of dementia are associated with psychiatric symptoms, including depression and apathy, anxiety, agitation. One distinction between vascular dementia and Alzheimer's is that depression tends to be more common in vascular dementia, whereas in Alzheimer's disease, apathy or a lack of motivation or interest is more common. This slide shows a comparison of MRIs of a patient with vascular dementia and a patient with Alzheimer's disease. And so the distinctions that I'd like to point out are highlighted by the arrows. So for vascular dementia, the red arrows are pointing to the white parts of the brain. These are changes. This is what happens to brain tissue when there has been some disruption of vascular supply. So this is what strokes would look like over time on MRI. Whereas on the bottom set of slides, a patient with Alzheimer's disease, the yellow arrows point to the spaces, the black spaces in between what we call gyri of the brain. So in between brain, and that's cerebrospinal fluid. So that has really no, that's what fills up the brain when there's loss of brain tissue. And in Alzheimer's disease, there is atrophy or a shrinking of brain tissue. And so what fills that up is CSF, which is in black. So you see, I'm sorry, I don't have a comparison to a normal patient or a patient without Alzheimer's disease, but what the arrows illustrate are enlargement of CSF space. So the first one are enlargement of what we call sulci, and then the next slide is, and the next two slides are enlargement of ventricles that contain cerebrospinal fluid. Mixed dementia. So what do we mean by mixed dementia? It basically means a combination of vascular dementia and Alzheimer's disease. Many people with vascular dementia will also have Alzheimer's disease. So on this Venn diagram to the right illustrates, first of all, the larger proportion of patients who have Alzheimer's disease, and there's an overlap with some portion of vascular dementia patients who have both, and that is what we refer to as a mixed dementia. Vascular dementia and Alzheimer's disease, though they do have distinctions, they also share some similar risk factors. Age is the largest risk factor for both. The presence of hypertension and diabetes, as well as obesity, are also shared risk factors for both Alzheimer's disease and vascular dementia. And then the final point on this slide is just to show that someone who has Alzheimer's disease, the course of their illness can very much be affected by the presence of vascular disease. So in the red, you see what a typical course of someone with only vascular dementia might be. So sort of a stepwise decline. In the dark blue is an illustration or a schematic of how a typical course of Alzheimer's disease might progress, just gradually and progressively. And then someone with mixed dementia, you'll see, will progress gradually at some points and then have some stepwise decline in between, which results in a overall more rapid progression of their dementia. And then you can have someone with very clean Alzheimer's disease without any vascular disease that would progress more slowly. So again, the progression of Alzheimer's can either be accelerated or slowed down depending on how much vascular disease there is. What can we do about vascular dementia? Well, first of all, the bad news, there is no cure and there is no FDA-approved medication to treat vascular dementia. However, more so than the other types of dementias, vascular dementia is preventable. And we do this by trying to control risk factors for stroke, if one has elevated blood pressure or cholesterol or diabetes. Optimal management of those conditions should reduce the risk for developing vascular dementia. Also, evaluation for heart disease is also very important because certain types of heart disease can increase risk for developing clots, and those clots can travel from the heart to the brain and cause a stroke. So it's very important also not only to look at overall vascular health, but also cardiovascular health or issues related to keeping the heart healthy. There are data that suggest that cholinesterase inhibitors, which include donepezil or Aricept, rivastigmine or Exelon, as well as memantine or Namenda, there are data that suggest that these agents are effective in at least temporarily improving memory or thinking in patients with vascular dementia. We may not be able to cure or necessarily effectively treat vascular dementia, but it is important to try to treat the psychiatric symptoms that may emerge over the course of the illness. Again, a couple of slides ago I mentioned depression is quite common in vascular dementia. So if the patient develops depression on top of vascular dementia, it should be treated typically with antidepressants, though at this point there are not very good studies that show that treating patients with vascular dementia and depression are effective, but I think they are worth prescribing. And then finally, just like with all the other types of dementias that affect the patient's functioning, it's important to provide support not only for the patient but also for the caregiver, and to have a good evaluation of the environment. Some of the behavioral disturbances or psychiatric symptoms that are associated with all the dementias are often the most challenging aspect of managing these illnesses, and they don't respond very well to some of our medications. They do respond to modifying the environment so that the patient and the caregiver are well supported, that the patient has what they need in their everyday lives to not become agitated or upset or depressed. So things like making sure that they have the appropriate stimulation at home or in the facility, making sure that all of their needs are met. Basic things like hunger and thirst and going to the bathroom. So just like with all the other dementias, the management of vascular dementia is no different in terms of support for the patient and the caregiver and the environment. So this concludes my presentation. Again, a reminder, if you'd like to ask questions, please use the hashtag UCLAMDChat on Twitter or comment on our Facebook page. So I'll just take a look at some of the questions that have been fed through. Sorry, there are quite a few. Okay, so first question, are there any lifestyle factors that might help prevent vascular dementia? Yes, we think so, and they are the same factors as what we think might prevent or at least slow down the progression of Alzheimer's disease. And those things are common sense things like daily exercise, a healthy diet, one that includes multiple servings of fruits and vegetables each day. Staying active, both mentally and socially, in addition to physical exercise. Second question, what type of doctors should I consult with if I think my loved one has vascular dementia? Well, I'm a geriatric psychiatrist. I certainly see a number of patients who have vascular and mixed dementias. So one option is to see a geriatric psychiatrist. I know not all parts of the country have access to geriatric psychiatrists. A psychiatrist, an adult psychiatrist who may have experience with the geriatric population, who maybe visits skilled nursing facilities or assisted living facilities where this is a very common problem, may also be a good idea. Geriatric medicine doctors, these are doctors who are internists but also have received specialty training in geriatric medicine. They are also seeing a lot of these patients and may have some good ideas about management and evaluation. Also, neurologists. These are doctors who specialize, who are trained in all sorts of brain illnesses, including Alzheimer's and vascular dementia. So they would be another very good resource if you know of someone who might have vascular dementia. Okay. Looks like those are all the questions that we have, so I want to thank you very much for participating in today's webinar. And if you have additional questions, you can certainly continue to, later on, you can certainly continue to tweet them or add them to comments on our Facebook page. Thank you very much.